Weaving is the life of the people of Pasay. It has been there for centuries already. But now we plan to give it more life from ordinary mats to something more contemporary na maging part siya ng fashion. Lara is one way of revolutionizing the banig industry, but it does not end there.
Ako po ay si Anita Mindova Ogrimin. Ako po yung presidente ng Basay Association for Native Industry Growth, in short, BANIG. nakakataba ng aming puso na global na pag-uusapan na ito yung ginagawa ng mga weavers ng Basay. Nung tulungan po kami ni Congresswoman Antan, umangat yung presyo ng banig. Sa ngayon, nakakatulong na kami sa pamilya namin. Pangarap po namin na magkaroon kami ng sariling processing center ng banig. Pangarap din namin, mas umangat pa ang buhay ng mga weavers at saka yung mga nagtatanim din ng tipog.
Gusto namin na ma-encourage yung creativity ng mga Samarno, ng mga Basaynon para mas mapansin pa yung industry na to. And hopefully, it will alleviate poverty as well. Weaving is the life of the people of Pasay. It has been there for centuries already. But now we plan to give it more life from ordinary mats to something more contemporary na maging part siya ng fashion. Lara is one way of revolutionizing the banig industry, but it does not end there.
Ako po ay si Anita Mindova Ogrimin. Ako po yung presidente ng Basay Association for Native Industry Growth, in short, BANIG. Nakakataba ng aming puso na global na pag-uusapan na ito yung ginagawa ng mga weavers ng Basay. Nung tulungan po kami ni Congresswoman Antan, umangat yung presyo ng banig. Sa ngayon, nakakatulong na kami sa pamilya namin. Pangarap po namin na magkaroon kami ng sariling processing center ng banig. Pangarap din namin, mas umangat pa ang buhay ng mga weavers at saka yung mga nagtatanim din ng tikog.
Gusto namin na ma-encourage yung creativity ng mga Samarno, ng mga Basaynon para mas mapansin pa yung industry na to. And hopefully, it will alleviate poverty as well. is the life of the people of Pasay. It has been there for centuries already. Now we plan to give it more life from ordinary math to something more contemporary na maging part siya ng fashion. Lara is one way of revolutionizing the banig industry, but it does not end there.
Ako po ay si Anita Mindova Ogrimin. Ako po yung presidente ng Basay Association for Native Industry Growth, in short, BANIG. Nakakataba ng aming puso na global na pag-uusapan na ito yung ginagawa ng mga weavers ng Basay. Nung tulungan po kami ni Congresswoman Antan, umangat yung presyo ng
Good morning. Welcome to the second International Poverty Conference hosted by Summer State University, co-hosted by Northwest Summer State University in collaboration with the 9 Eastern Visayas State Universities and colleges. My name is Natalie, your moderator. Before we kick off, please be guided by our online etiquette. All right, so for our participants who are already on board right now, I would like to remind everyone for our online rules and etiquette. So first, turn off notifications. Those little things are distractions to other meeting attendees. And also, we need to turn on the lights. If you can't get proper lighting, sit near a window or have a bright lamp nearby. Look at the camera when talking. It's a bit awkward at first, but your audience will appreciate eye contact. Mute your mic if you are not talking. Clear the space behind you. See if you can move your camera so it is directed to a wall or a clear spot. Please come early. If someone is late, there is no need to recap. Keep it professional. Maintain professional posture and appearance. and stay present. You might miss out on key information. If you are using your webcam, use attentive body language. And of course, give some grace. Be patient with participants and allow some grace for any communications that occur. We hope everything is on set on your virtual rooms, and we will be right back after these videos.
Sa ngayon, nakakatulong na kami sa pamilya namin. Pangarap po namin na magkaroon kami ng sariling processing center ng banig. Pangarap din namin, mas umangat pa ang buhay ng mga weavers at saka yung mga nagtatanim din ng tikog.
Gusto namin na ma-encourage yung creativity ng mga Samarno, ng mga Basaynon para mas mapansin pa yung industry na to. And hopefully, it will alleviate poverty as well.
At this juncture, let us invoke the presence of the Father Almighty. The first day of the second international conference was a successful opening and a warm start of a fruitful 3-day conference. We were graced by renowned speakers and guests not only from our very own Philippines, but also from our neighboring countries all around the globe. We were joined by our partner collaborators, our very active SUCs of the Eastern Visayas, namely Northwest Summer State University, our co-host for the iPOVCON 2020. Eastern Visayas State University, Eastern Summer State University, Leyte Normal University, Biliran Province State University, Southern Leyte State University, Visayas State University, University of Eastern Philippines, Palumpon Institute of Technology, and also St. Paul School of Professional Studies. We were also joined by the different state universities and colleges and national government agencies across all of the Philippine island. The day one was a heartfelt opening as we were warmly welcomed by our very own community leaders, the Amay Hansama, Governor Michael Tan, and the ever enthusiastic Congresswoman of the Second Legislative District of Samar Province, Congresswoman Sharian Tan. And of course, we were also earnestly welcomed by the leading flight of Samar State University, the mind behind every fruitful poverty conference, Samar State University President Dr. Marilyn D. Cardoso. The Day One International Keynote Speaker, Dr. Christopher Galloway, head of the public relations of the Massey University, New Zealand, talk about their country's best practices in the areas of risk, communication, and successful handling of the coronavirus disease. He also talked about how the local government units play a crucial role in strengthening resilience and minimizing risk, and how the academe shall assist the LGUs in providing appropriate education programs and trainings. After the session came and another distinguished guest graced yesterday's virtual event. We had the chance to listen to the inspiring words of one of the commissioners of the Philippine Commission on Higher Education, no other than Dr. Aldrin A. Darilag. In his afternoon keynote address, he talked about how to address poverty through education. He discussed different ways on how teachers, educators can address the needs of their learners who live in the margins of poverty. And that is through changing the school culture from pity to empathy, deepening the understanding of employees, embodying respect, embedding social skills in all lessons, and being inclusive. He also shared the different initiatives of CHED to help combat COVID-19 in partnership with the academe and LGUs. Finally, in the last part of the afternoon session, we were joined by our fellow research enthusiasts in one of the highlights of this entire poverty conference, the competition for the most outstanding paper award. Yesterday, four researchers from the University of Terengganu, Malaysia, Visayas State University, and of course, the Samar State University, Philippines, competed for the title of the Most Outstanding Paper Award. And that was the recap for the first day of this third day International Poverty Conference. Today, we continue living and rising above the crisis as we take into the heart the words of our dear Commissioner, Dr. Darilag, yesterday, and I quote, "Let us continue to help free people from poverty in all of its forms." Poverty warriors, you are now on board For the track 1, under the category of human health crisis and management research presentation. Just to give you a background of our track, which is the track 1 human health crisis and management, there are 8 presenters for this track, and this presenter will be evaluated based on our mechanics. So we will be presenting to you our mechanics or guidelines for our presentation to all our presenters. So we have our guideline for the best oral presentation. So presenters are given a maximum of 10 minutes to present their papers in their identified strand during the parallel sessions, which we will be doing later on. After every presentation, the question and answer portion will commence. And now also for papers with multiple authors, only one author is allowed to present and answer during the question and answer. However, as long as the co-authors have registered for and attended the conference, they will still be provided the necessary certificates of presentation. So let us remember that each participant or presenter is only given 10 minutes. And also the best oral presenter will be chosen from each strand. So best oral presenter respective track should earn at least 85% to qualify for the award. And the decision of the panel of judges shall be final and unappealable. So the rating sheets are considered personal notes of the panel of judges and shall not be given to any contestant or requesting party. So we have our guidelines. So here are the points. So the judging shall be based on the following criteria. So we have for the best oral presentation, under technical, we have the originality of idea, appropriateness of the methodology. So for the originality of idea, we have 10 points. Appearance of For the appropriateness of methodology, we have 20 points. Potential of the creation of new or advancement of knowledge and evidence of benefit to the area covered by the research, that is worth 10 points. And anticipated outputs, outcomes, and impacts of the research, including potential contribution to economy and social benefits, that is 10 points. And also we have the quality of technical paper, which includes quality of submitted technical report, including abstract, that is 10 points. So under technical category, we have in total 60 points. And another half of that will be the actual paper presentation. So for the actual paper presentation, we have the presentation, which includes overall impact on the audience, understandability, concise reporting within the given time frame. That's the total. We have the total of 10 points. Format presentation, which includes the clear description of the research and follows given format, that is 10 points. Researchers' salesmanship. So this is include the knowledge on the project, and communication skills is 20 points. So we have 40 points, but the grand total is 100 points. So I hope our presenters were able to remember our criteria for judging for you to get the best presenter and the best paper. And also for our track one, which is human health crisis and management. So let me just give you a short background about the track one. So the human health crisis and management, this strand shall tackle the general concept of human health crisis and crisis management. This track shall also discuss how humans deal with human health crisis before, during, and after a flight. Right, so I am now excited to present to you our panel of evaluators and to help us select our winners for this 2020 Second International POVCON. We have our first evaluator. Our first evaluator is an associate professor from the University of the Philippines College of Public Health, no other than Dr. Shariah Lane M.D. Paz Silava.
Good morning, everyone.
Our second evaluator. Our second evaluator is a medical officer 4 and also a section head, a local technical assistant in program management at the Department of Health, Resonate. Ladies and gentlemen, we have Miss Fidelita D. Dico.
Good morning.
Good morning, Dr. Dico. And also, last but not the least, we have our last evaluator. He is a medical technologist 4, research program manager at the Department of Health, Originate. Ladies and gentlemen, we have Mr. Leonido P. Olovia.
Good morning, everyone. Hi.
Good morning to our evaluators. Welcome to our second International Poverty Conference. Welcome to Summer State University. So later on, you will be hearing and you will be able to witness the different presentations of our presenters. All right, so I guess everyone is ready. Everyone is excited, especially our presenters. And let us now start. So I think the ball will now start rolling. Okay, so our first presenter is from Naglawaan National High School, Department of Education, Ilocos Sur, Philippines. He is a senior high school teacher and a school research coordinator with research paper entitled Ilocano's Search and Experience of Ginawa in Times of COVID-19 Pandemic. Ladies and gentlemen, we have our first presenter, Mr. Jeric T. Gonzalez.
Good morning, ma'am. Good morning and good day, everyone. First of all, I would like to thank Summer State University for giving me the opportunity to share my research study on the second International Conference on Poverty Alleviation and Sustainable Development. The theme of this year's conference
While waiting for our video presentation to be played, I would like to announce to everyone that the awarding of the most outstanding paper and best paper presentation will happen on the third day of our International Poverty Conference, which will be happening on October 23, 2020. So again, the awarding of our most outstanding paper and best paper presentation will happen on the third day. So that will be on October 23, 2020. And this is to remind our panel of evaluators and to our presenter that your video presentation should only be played for 10 minutes. In our question and answer portion, we will only give 5 minutes. So we would like to request our evaluators. So there will be one question for each evaluator. Okay, so I think our video presentation will now play.
What we are really experiencing right now. And the query that is connected to the theme is, how can we rise? In this regard, I am going to share my research on how Filipinos, particularly the Ilocanos, search and experience ginhawa, or in Filipino, it is translated as ginhawa in the times of COVID-19 pandemic. I am Mr. Jeric T. Gonzalez, a senior high school teacher from Naglawaan National High School, Santo Domingo, Ilocos Sur. The advent of COVID-19 pandemic brought the entire world into severe chaotic conditions. It was in March 2020 that the virus had spread worldwide. To mitigate the widespread of the virus, many countries needed to sacrifice economy by providing basic survival necessities of their countrymen. In the Philippines, the continuous elevation of positive cases alarmed the entire nation. Many establishments were closed due to physical and social distancing. Strict health protocols were implemented. People were confined in the vicinity of their homes. Military, police officers, and barangay officials strictly implement rules and regulations. Due to this pandemic, the unemployment rate in the country increased. The Philippine Statistics Authority reported that there are 17.7% or 7.3 million Filipinos who do not have jobs as of April 2020. And this is associated to the economic shutdown due to COVID-19 pandemic. Because of this, there is a tendency that those Filipinos who lost their job might suffer depression and other mental health problems. They do not know where they could find money to buy food, which is a basic good for survival. The next movement is Filipinos are going to look for remedy which gives them comfort or ginhawa. What is ginhawa then? According to Leonardo Mercado, SVD, the word ginhawa is associated with the soul or spirit of the Filipinos. It has varied meanings, but for modern Cebuano, ginhawa means stomach, pit of the stomach, breath, lungs, vital spirit, and intestines. It can also refer to food, appetite, disposition, character, and condition. When it comes to disaster, most people primarily look for relief goods. The concepts and researches regarding ginhawa dealt on philosophical definition and the practice of the word after a disaster. But the question is, how can we find ginhawa in the midst of COVID-19 pandemic? How can we understand ginhawa in the context of other people, particularly the Ilocanos and other ethno-linguistic groups in the Philippines? In this study, the researcher analyzed how Filipinos, particularly the Ilocanos, search and experience ginhawa amidst the COVID-19 pandemic. This study can provide insightful findings on how Ilocanos search and experience ginhawa in the midst of COVID-19 pandemic and contribute to the collective experience of the Filipinos. Likewise, the findings of this study can showcase the Ilocano psyche and how they respond to the dilemma brought by the pandemic. Furthermore, this study can serve as a guide for understanding ginhawa in the context of the Ilocanos and so that the government could think of actions that would address the needs of the people in the midst of a disaster in health. At last, this research can be a source of another study, the research. Objectives of the study. This phenomenological study mainly looks on how Ilocanos search and experience ginhawa and its essence in the time of pandemic. Furthermore, this study aimed to provide answers to the following questions. How did the participants search and experience ginhawa in times of COVID-19 pandemic? What themes have emerged based on the lived experiences of the participants? For the methodology, phenomenological research design was used. This design is applicable, especially the study dealt on the experience of the participants. In the selection of sampling, maximum variation sampling was used. There were 30 participants of the study. Interview and observation were utilized as research instruments. Due to physical and social distancing, the researcher preferred to chat and call the participants. Prior to this one, the researcher asked consent of the participants to be part of the study. Ilocano language was used so that the participants could freely express their answers. Thematic analysis was used in the study to look for themes that have emerged. It is important to note that in the analysis of data, it is within the premise of moderatum generalization, which means that the result of the study applies only to the participants and does not generalize the whole Ilocano people. Based from the result of the study, 3 themes were identified based from the thematic analysis. These themes are anchored in survival, panagbiag, pleasure, pagragsakan, and affection, panagayat. The researcher put these 3 in a simulacrum, and it is called the Ilocano's Pyramidal Lens of Ginawa in times of COVID-19 pandemic. Survival is on top because the participants prioritize basic necessities to survive, while pleasure and affection are at the bottom because these 2 are secondary sources of ginawa for the participants. Now, let's go down with the details of the 3 teams. First team survival, panagbiag. During the time of pandemic, the top priority of the participants is how they can survive. Survival for them is divided into 2 aspects of life, physical aspect and the spiritual aspect. In the physical aspect, participants can feel ginawa if they have food to eat. This is very vital since this is one of the basic needs of man to survive. Looking for food during the state of enhanced community quarantine was very limited. Money is such a basic need in order to buy food. In line with this, they engage in business such as online selling in order to gain money. Aside from this, they engage also in planting vegetables and fruit-bearing trees. Aside from feeding oneself, observing health protocols is also a way of experiencing ginawa. In the spiritual aspect, ginawa is felt when they attend religious gatherings. This is also anchored in survival for Ilocanos have a strong belief in God. They pray because they want to survive, for they believe that the pandemic is not only through medication, but a need for divine intervention. The next theme is pleasure, or in Ilocano, pagragsakan. The participants found ginawa through watching videos, taking pictures, reading literatures, listening and playing music, and planting ornamental plants. Pleasure in doing leisure activities give also comfort. It is natural to human to have some leisure for relaxation and enjoyment in the company of others. Dr. Binhoven mentioned that pleasurable activities give rise to the positive affect, and positive affect works as a go signal.
Yan.
This go signal enhances activity. In addition, the result of the study of Talidong and Toquero on the situations of Filipino teachers in pandemic reveals that teachers engage in activities such as cooking, gardening, and reading. The third theme is affection, or in Ilocano, panagayat. Participants found ginawa when they help other people, roam around with their friends, video calls their loved ones, and visiting their relatives. It was very interesting to emphasize that amidst the crisis, affection towards other people are also ways of looking for ginawa. And this starts the value of emotion of loving. Every people seek attention and love, for this make them feel that they are important. In the survey conducted by Frejas, after the lifting of ECQ, Filipino meet their loved ones, practice faith, and resume livelihood. And this became as one idea around psychosocial rehabilitation after a disaster. Assisting other in times of need could also beneficial to the person receiving support and the helper. This is the Ilocano's pyramidal lens of ginawa in times of COVID-19 pandemic. Conclusion and recommendation, the COVID-19 pandemic brings a catastrophic tragedy to the whole world. However, in this pandemic, it is again proven by the Ilocanos that they are disaster resilient, hence not prone to depression. It is rooted in the Ilocano psyche that even in the middle of a great phenomenon, Ilocanos still manage to look for ginhawa. It is instinctual or natural for Ilocanos to be looking for ginhawa. The search and experience of ginhawa are anchored on survival, pleasure, and affection. Having a positive disposition in life despite crisis can give comfort. Thus, Ilocanos should continue the things that give them ginhawa. And looking for ginhawa is a communal activity rather than individual. Hence, the government, local and national, should provide support such as livelihood program for the Ilocanos who were affected of the pandemic so that they have something to gain for their survival. The Ilocano culture of kinaruba, neighborhood, and panagkinamayet solidarity should be intensified and be taught to younger Ilocanos, for these are intangible cultures that promote positivism and optimism in good and bad times. And all of these, the activities that the Ilocanos are doing could be emulated by other Filipinos and the world so that they can also find comfort. As my take-home message, in the midst of crisis, let's look for the things that give us ginawa. Together, we will rise. These are my references. Thank you very much for listening and have a good day.
All right, so that's a presentation, the video presentation of Mr. Jarek T. Gonzalez. So I would like now to call our evaluator. So each evaluator should only throw one question. And by the way, if the time would limit, because we only have 5 minutes, our evaluators, you can chat down your questions to our chat box, and also our researcher could also answer those questions in our chat box. Thank you. So may I call in Dr. Silava?
Hi, good morning, Mr. Jarek.
Good
Congratulations.
morning. Thank you, ma'am. Thank you.
I just have one question. How did you sample your study participants? Because I noticed that for the part that talked about Netflix BLK dramas and BL dramas and K dramas, I have this perception, or making self videos such as TikTok and the like. I have this perception that your study participants were young people, or probably in the 20 to 30 age bracket, but I didn't see any description in the paper. How you did your sampling, or what is the description, how many were male, how many were female, how many were young, how many were old. So I would just like to know how you did your sampling, or how did you choose your study participants. And
Okay.
you can give also just a brief description of their demographics. That's all. Thank
Yes.
you.
Thank you, ma'am. Actually, when I recruited my participants, I consider that the present situation now, because of due to physical and social distancing. So most probably my participants were young. Especially, I interviewed also my students because I am a senior high school teacher, and then also I interviewed also our neighborhoods who were doing activities like this during the conduct of my study.
Okay, thank you.
Thank you very much, ma'am.
Thank you so much, Dr. Silava. And now may I call in Dr. Dico to give your question to our researcher.
Yeah. Good morning to our MC. Good morning to Mr. Jerry.
Good morning, ma'am.
Thank you and congratulations for a good view and a good presentation of your phenomenological study.
Thank you, ma'am.
This talks about Ilocanos, but maybe it also talks about many Filipinos. I would just like to know if you have already a plan to disseminate this study, and to what group would you like it to be disseminated, so that one of your study purpose will be met.
Thank you, ma'am. Actually, the study is in the premise of moderatum generalization, which means that the study is only applicable to the participants of the study. However, since this study has already magnified how Ilocanos, particularly the participants, look for Ginawa in times of COVID-19 pandemic, I am planning to disseminate this through social media also after the presentation. And of course, I am planning also to present this to our LGUs so that they could be of help in elevating the livelihood programs of our neighbors or the Ilocanos, particularly the participants who were affected this pandemic.
Okay. Thank you very much, Mr.
Thank you,
Jerry.
ma'am.
Thank you so much, Dr. Dico. And now may I call in Mr. Olivia to give your question to Mr. Jerry. Go ahead.
Good morning, Mr. Presenter. I'm very
Good
happy
morning,
to
sir.
listen to your presentation. If you will be asked to provide policy recommendations to your area in your place, what do you think are the policy recommendations that you can give based on your study?
Uh, Thank you, sir. Uh, as a policy recommendation, actually it will be dealt with the providing provisions of livelihood programs to the communities, especially in our communities, where some of my when I took some of my participants, providing them livelihood programs, especially for this type of pandemic, could at least elevate their livelihood in this time, and of course, it could support their survival. And another
Okay,
thing
thank,
is for the LGUs also and for the barangay captains so that they will also be notified on how Ilocanos, particularly these participants, can also feel comfort in this time of pandemic because of course we are all suffering this very trying times, depression, anxiety, and all these mental health problems. So we can I can submit the result of my study to the local government, especially to our community. Thank you, sir.
oh, okay, thank you.
All right, thank you so much, Mr. Olivia, for your question. And also to our presenter, first presenter, Mr. Jerry T. Gonzalez. Thank you so much, sir.
Thank you, ma'am.
And now, yes, we will move on to our next presenter. Our next presenter is a faculty from Summer State University with research paper entitled Physical Mobility of Senior Citizens for Health Sustainability. So ladies and gentlemen, I would like to give to you Mr. Jonas F. Fabiliar.
Contributes to maintaining a good physical well-being. Adults, as we will all become in the future, must value physical mobility, healthy lifestyle, diet, and exercise. To our research panel and to everyone who are aboard, good day. May I present to you my study entitled Physical Mobility of Senior Citizens for Health Sustainability. Longevity is not about luck, it is about how willing we are to put effort for it. Physical mobility refers to the ability of humans to move around their environment. Lack of mobility due to aging, for example, may result of physical and mental disorders, which in the long term will restrict people to doing something physically, socially, and mentally. One major determinant of physical inactivity is the inability of the body to fully function. In addition, physical mobility may be affected by many factors such as trauma, spinal cord injury, and other chronic diseases, and it can also be found generally in the aging masses. This study adheres to helping senior citizens maintain their functional and healthy self even after retirement by assessing their physical mobility for health sustainability. Currently, There's an existing health program by the Department of Health, like free consultation and medication to senior citizens, but this program lacks sustainability. Hence, the conduct of this study is deemed necessary. The fundamental reason of this study is to assess the mobility levels of senior citizens and create a physical mobility health program in a countryside setting in the Philippines. Further, inputs from the study would serve as a basis for a well-implemented physical mobility program. Here are the objectives. First, assess the mobility levels of senior citizens. And second is develop a physical mobility program to be adopted by the local government unit. For the methodology, this study utilized a descriptive research design in the assessment of physical mobility level and lifestyle of the respondents. Furthermore, correlation analysis was employed in determining the relationships among the variables. Senior citizens in Paranas, Samar were the respondents of this study. In gathering the needed information, the researcher used questionnaire as its principal data gathering instrument. Standardized tools for assessing the physical mobility and lifestyle of the respondents was used. The data were gathered, sorted, and interpreted using appropriate statistical tool for descriptive research. Afterwards, based on the results of the study, the researcher crafted a physical mobility intervention program for health sustainability of senior citizens. The following is the conceptual framework of the study. For the results and discussion, the male respondent's mean age is 66.50 years, while the female group mean age is 67.57 years, with a combined mean age of 67.13 years. The data implied that the mean age of the respondents fall under 60 to 70 years with low mobility. Low mobility means majority of them reduces walking speed with lower body activities and experience challenges in their daily lives. It is suggested that people of this age must engage in activities that will somehow improve their motor response through leisure time physical activities such as walking, dancing, gardening, hiking and swimming, and the like. In terms of transportation, they are encouraged to go on cycling or biking and boost their capacity to do household chores and sports or planned exercise. The modal income of respondents is posed at 10,000 below, with 34 of them, and with highest income is only 1 or 2.57%. The data imply that majority of the respondents have low income. Higher income was associated with higher self-reported leisure time, physical activity for women and men. Second, the pedometer-based results differed by gender. The association was negative or non-existent for men and positive for women. It is therefore suggested that aging population of 60 above should have enough income to compensate their daily activities such as leisure time. From the results, it is evident that people aging 60 years old and above with very low mobility because majority of them, as shown by the data in yellow highlights, that they never engaged to aerobic activities such as hiking, biking, swimming, and sports. However, a certain activity is done through daily engagement to walking. Walking shorter than 1 minute were classified as short walks, while walks of at least 1 minute were classified as long walks. It is therefore suggested that older adults must do some walking activities or exercises to maintain physical mobility. it can be observed that the aging population of 60 above are with low muscle strength because majority of them does no longer engage in recreational games, lifting weights, push-up and curl-up, rock climbing, and aerobics. However, there are 7 out of 39 respondents still engages in weightlifting for 5 to 6 days a week. Strength training is effective in elderly persons and can be undertaken without notable adverse effects. Using strength training has been used in prevention and rehabilitation of different symptoms, for example, in osteoporosis and degenerative joint disorders. It is suggested that senior citizens aging 60 and above should engage in muscle strengthening activities with moderation in order to maintain a good muscle composition and body posture. Majority of the respondents, or 25 out of 39, are assisted in walking, same with eating that showed the same result. While they can also hardly do household chores, which 24 out of 39 or 61.53%. The data implied that majority of the respondents need assistance to help them walk, eat, and do household chores. Even when services and programs are available, aging population of 60 above sometimes refuse them or they may lack experience in accessing or have difficulty in accepting that they need these services. Thus, they may resent subjecting themselves to unnecessary requirements like loss of control, and they may feel judged or may feel services are not specific to their needs. Therefore, it is suggested that senior citizens should have good support system or services for them to accomplish daily tasks and activities to further help them maintain mobility. The above table showed that majority of the respondents no longer engage in long distance travel, while 23
All right, thank you so much. We have our presenter, Mr. Jonas Paviliar from Summer State University. So may I now call in our evaluator, Dr. Silava, to ask one question to our researcher.
based on the
I'm
results.
sorry, what's the name of the researcher again? I missed that. Jonas, am I right, Mr. Jonas?
Jonas,
Okay.
yes.
Good morning, Mr. Jonas. I just want to
Morning
know
po,
how
ma'am.
you decided on the activities to evaluate. I'm curious because you chose activities like hiking, biking, swimming, sports, walking, lifting weights, gym, yoga, and I honestly think that these activities are not necessarily popular in our culture, especially in the rural setting. So I was wondering how you chose these activities to evaluate, especially for participants 60 to 80 years old, instead of looking at activities of daily living for your study. That's all.
Thank you, ma'am, for your question. To everyone, I would like to apologize for the low audio. I didn't have an idea that the audio would not be compatible. Ma'am, the researcher assumed that senior citizens, which is the respondents of the study, are still mobile, even if they are 60 and above. So it assessed different physical activities in terms of aerobic, in terms of muscle strengthening activities, in terms of bone strengthening activities, assisted physical activities, and unassisted physical activities po, ma'am. And those activities that were mentioned were categorized based on those five types of activities po.
Okay, thank you.
Thank you po, ma'am.
Thank you so much, Dr. Silava. Now I would like to call Dr. Dico to ask our researcher.
Yes, good morning once again to our participants and evaluators. Just have also one question to Mr. Jonas. And this is much related to Dr. Silava's question related to how
Ma'am, I think you're muted po.
I sorry. Sorry. Am I heard now?
Yes, ma'am. Go
Thank
ahead.
you.
Yes, ma'am.
My question is related to Dr. Silava's question, which says that these activities are not much popular in our culture. But if I understood it right, Mr. Jonas said that you sort of substitute or identify these activities related to like biking and swimming and others. Now, fast forward, um, did you also consider this assessment that there are less mobility in these types, in these adults? Did you factor in their age and their limitations, such as illness and disability, to affect their kind of mobility? So it's just about putting this assessment of low mobility among these study groups if the if the age and the illness or disabilities had been factored in your result. Uh,
Thank you, ma'am, for your question. In the instrument of the study, um, lifestyle was actually included as one of the factors to be considered, and health history po, ma'am. And it was found out that health is actually one of the major contributory factors why our senior citizens have low mobility. And these activities, however, are not that popular in our culture in the Philippines. But the study was conducted in the municipality of Paranas po, which is along the road, and is assumed that these senior citizens are still physically active since we have access to leisure parks, we have access to areas that encourage physical mobility, such as um, we have Zumba class actually in our municipality, for example, and other activities in which I believe Paranas is a productive municipality. Thank you po.
okay, thank you.
Thank you so much, Dr. Dico. And now may I call in Mr. Olobia.
Hello, Jonas. I would like to say you have very good findings in your study.
Thank you
given the
po, sir.
limited area. Uh, Given these good findings from your research, what do you think are some of the limitations of the study?
I believe, sir, one of the limitations of my study is uh, the number of respondents that I got. That's why, sir, in the recommendations, it was recommended based on the study that longitudinal study has to be conducted with a larger population size to challenge the result of my study po, sir. And another limitation, sir, is that the respondents are hesitant to reveal their health history, which I also believe is a confidential matter po. Kasi some of them are hesitant po to answer that part of the questionnaire. And I actually have assured to them that the data that will be gathered will be treated with utmost confidentiality and will only be used for the research, and whatever will be the findings of the study shall be recommended to the LGU of Paranas so that the program will be implemented, and later on the program will also be sustained if the local government unit of Paranas will give fund po to the program. Thank you po, sir.
Okay, thank you very much.
Thank you so much, Mr. Olivia, and of course to our researcher, presenter, Mr. Jonas Pabiliar from Somers State University. And now let's move forward to our next presenter. Our next presenter is the Director for Institutional Research and Ethics Review from Somers State University with research paper entitled Patient Satisfaction to Nursing Service in Government Hospitals of Region 8. So ladies and gentlemen, let us all witness the video presentation of Dr. Ria Jane A. Rosales.
Back to the panel of evaluators and greetings to everyone on board. Allow me to present my study entitled Patient Satisfaction to Nursing Service in Government Hospitals of Region 8. In any healthcare institutions, nursing service is vital in providing quality patient care, which aims to satisfy every client in all aspects. Wagner and Baer 2009 presented the three domains of patient satisfaction, and these include the educational relationship domain, or the nurse's attitude with patients, technical professional domain that concerns the technical issues on care, in the trusting relationship domain, which involves the interpersonal relationship situations between the nurse and patients. This also involves the verbal and nonverbal communication that occurs between the nurse and the client. Nurses must perform all these domains suitably to satisfy the patients. Globally, there is a common observation that private hospitals are better than public health institutions, especially in areas like advanced technology, offers personalized care, clean, comfortable, and with better workflows. Public hospitals, on the other hand, are perceived to be overcrowded, understaffed, poorly managed, there's scarcity of supplies, and does not conform to the standard nurse-patient ratio. For decades, government hospitals consistently faces challenges that gives the general impression to the public that private hospitals provide quality healthcare services than public health system does. And one of its challenges is the massive turnover of nurses every year. In fact, the POAA reported 92,277 Filipino nurses left the country to work abroad, with the reasons of undercompensation, heavy workloads, inappropriate nurse-patient ratio, and understaffing. And now that the Philippine government, like other countries, continued its effort to address the challenges and improve the healthcare services in the country through offering universal healthcare, the government hospitals will never refuse admitting patients even the bed capacity is not enough, especially in the district hospitals. Consequently, with the increasing number of admissions and fewer number of nurses, Labragi et al., Maselink and Lee 2010 suggest that this could contribute to poor quality of patient care. Now, what is the importance of patient satisfaction survey? Patient satisfaction survey plays a vital role in providing feedback on the quality of care the health institutions are rendering, whether they provide adequate resources, and the how of rendering quality services. They are used to attain, maintain, and monitor the services. They are emphasized that patient satisfaction surveys have gained increasing attention as meaningful and essential sources of information for identifying the gaps and developing an effective action plan for quality improvement in healthcare organizations. Now, improving patient satisfaction to nursing service poses a major challenge in the government hospitals, especially in the Philippines. Now, the findings of the study hopefully open the eyes of the healthcare providers, including the nursing administrators and government, to further improve the quality of care rendered in the government hospitals in Region 8. This study aims to determine the satisfaction level and predictors of patient satisfaction to the nursing service in government hospitals in Region 8, Philippines. The study employed a descriptive correlational design. This was participated by 203 patients from the 5 government hospitals in Region 8. The researchers set inclusion criteria, and this includes patient must be physically and mentally able to answer the questionnaire, surgical, OB wards, or intensive care units for at least 3 days, and consented to participate in the study. The researcher adapted a standardized tool from Karambulis and Adamakis in 2012 named Ricer Patient Satisfaction Scale, which includes the 3 domains. This is a 25-item questionnaire with 0.89 coefficient reliability rate. And for the scoring, the higher the score, the lower the patient satisfaction level. And for the items which are negatively worded, the scoring is reversed. This was conducted in secondary government hospitals in Region 8. Descriptive and inferential analysis was utilized in the study. Specifically, a stepwise multiple regression analysis was employed to assess if the patient's profile predicts the patient's satisfaction. For the ethical consideration, patients' consent and approval to conduct the study in the 5 government hospitals were acquired respectively. Anonymity and confidentiality were practiced during the conduct of the study to protect the participants. Now, let me share to you the important results and discussions of my study. For the respondents' profile, patients' age range from 21 years to 40 years is mean age of 37 years. This implied that majority of the patients are young adults under the psychosocial development theory of Erik Erikson. And if you can see, majority of the patients are married because this is also the intimacy stage. This study is dominated by women. Majority were admitted at the medical ward. And for the PhilHealth type, majority of the patients are under the indigent category. For the duration of confinement, majority of the patients were admitted to 3 to 5 days, and followed by a little disparity of patients admitted within 6 to 10 days. So for the first domain of patient satisfaction, which is technical professional domain, the overall mean is 2.64, which is interpreted as fairly satisfied. Now, here are the indicators where patients reported to be fairly satisfied. One is the nurse makes it a point to show me how to follow medical instructions. The nurse is often disorganized to look on top of things, and the nurse gives good advice. Meanwhile, they were satisfied in the indicators states the nurse is skillful in assisting the doctor in various procedures, the nurse really knows what she is talking about, and the nurse is precise in doing her work. This suggests that these patients saw how nurses are capable in doing their work. Now, for the educational relationship domain, the overall mean is 3.25, which is interpreted as fairly satisfied as well. These are the indicators that posted the highest satisfaction rating. First, the nurse explains things indicators are: I wish the nurse would tell me about the results of my test more than she does. And the nurse asks a lot of questions, but once she finds the answers, she doesn't seem to do anything. Now, these nurses should improve their attitude towards patients, especially in exchanging information regarding the patient's condition and management. Now, for the last domain, which is trusting relationship, the only statement where patients reported to be satisfied is the statement that says the nurse is a person who can understand how I feel. However, the indicators where patients reported to be dissatisfied are the following: the nurse is attentive enough, the nurse spends time talking with me, and the nurse is friendly enough. So spending lesser time in listening to patient talking to patient and then able to establish rapport to patients could be associated with inappropriate staffing and scheduling in these hospitals. This proper nurse-patient ratio must be followed to ensure safe and quality patient care, thus increasing the patient satisfaction. Now, for the stepwise multiple regression analysis of the patient satisfaction level with respect to their profile, age is the best predictor among all the profile variables to patient satisfaction. Finding shows that older patients have greater satisfaction level compared to young patients. Ward assignment is another predictor of patient satisfaction, where the findings suggest that the patients admitted in the ICU are more satisfied compared to patients admitted in the ward. Field health type is another indicator, where the result also suggests that indigent patients are more satisfied compared to field health member patients. Now, for the conclusion, patients reported to have fair satisfaction level with an overall mean of 3.05 to the nursing service rendered in the secondary hospitals in Region 8. Among all the three domains, technical professional get the lowest mean, which suggests that this is the domain where patients have greater satisfaction. This is followed by the educational relationship, and lastly is the trusting relationship. Age, ward assignment, and field health type affects the level of satisfaction of the patients. For the recommendations, this emphasized during the orientation of nurses on the legal principles governing the treatment of patients as defined in the Act on the Status and Rights of Patients, that patients are entitled to be treated respectfully and appropriately by healthcare personnel. Hence, those predictors would not matter for treating the patient less. Employ enough and qualified nurses to meet the appropriate nurse-patient ratio. Hence, nurse providers will be able to spend enough time to establish rapport and perform quality nursing care to all patients. Though the technical professional domain get the highest satisfaction level among the three domains, being rated as fairly satisfied suggests that there is more room for improvement. And the last, it is better that these institutions will apply for International Standardization Organization certification, because this will ensure that these institutions will achieve quality and safety in the healthcare. Thus, patient satisfaction level will improve. That's all. Maraming salamat po.
All right, thank you so much, Dr. Ria Jane A. Rosales, for your presentation. And now, may I call in our first evaluator to ask our researcher, Dr. Silava.
Good morning, Dr. Rosales. Congratulations to your study. I think this is a very significant study.
Thank you. Thank you,
Considering
Doctor.
that I also work in the Philippine General Hospital, which is another
Yes.
public institution. Okay, anyway, so you have a lot of recommendations, and after the results of the study, what do you think is the next most logical study to make? If you're going to make another follow-up study, of course, we just look at patient satisfaction at this time. But knowing your advocacy based on the presentation you had, if you're going to make a follow-up study, what do you think is the next most logical study to do so that your study can have an impact in policy?
Thank you. Actually, this study has been, I already communicated the result of the study in the institutions that were involved in this research. So I think the effectiveness of this or the strategies they did to improve the patient satisfaction of the patients in terms of healthcare delivery.
Okay, thank you. And if I may suggest, I think one of the things that you can also do is to compare private and public hospitals. You can also look into correlations between morbidity, mortality, infection control, and all these medical outcomes. This will also add more impact to your study. That's all.
That's right. That's right. Thank you, doctor.
Thank you so much, Dr. Silava. Now may I call in Dr. Dico.
Yeah. Good morning to our presenter.
Good morning, Dr. Dico.
Yeah, thank you so much and congratulations for a good study. It will generate many more studies. It is just a curious question. Um, why did you not, or in your study, uh, there could have been an additional comparison between different wards. Say for example, pedia versus internal med ward, or private room versus other the the whole ward, because it has something to do with the number of cases attended. But you preferred to compare ward versus ICU. This is just a curious question. Why did you prefer to compare the two rather than compare between different wards from different departments? Because they comparing general ward with less patients to attend to than an ICU, which has more patients with more demands or more high quality level of care, may not be of may not be of same level of attention. So just a curious question, why did you prefer to compare the two wards?
Okay, thank you, Dr. Dico. Actually, part of the objective is not to compare the different wards, but part of the objective is to assess only the satisfaction level. It's just that in the stepwise multiple regression analysis, the result shows that um, the patients in the ward shows or reported low satisfaction level compared to the ICU. So that's all, Dr. Nico.
Okay. So anyway, that's true. I'm not telling you to compare the two words, but to compare the satisfaction level of the two words. But thank you for your answer.
Thank you.
Thank you so much, Dr. Dico. And now may I call in Mr. Olovia.
Okay, thank you very much, Miss Mamria Jane, for your good research.
Thank you.
Uh, I'm just curious that the age group of your respondents was 21 to 40 years old, meaning to say some of the patients uh, reaching the senior age group or even below your senior age group, 50 years old above and 60 years older, were missed out in your study. Do you think you did not commit a mistake in the sampling of the subjects in your study
Mm, okay,
because you
Doc.
were not able to cover the good range of age for the patients?
Uh, Actually, because I set an inclusion criteria, so those age group I think are those age group covered the inclusion criteria that I set.
Yeah, but do you think you did not miss out some vital information from patients much older than 40 years old? You did not
Uh,
consider that.
I don't think so po.
Okay, thank
Hopefully
you
not.
very much.
All right, thank you so much, Mr. Olobia, and to our evaluators as well, and also to our presenter, Dr. Ria Jane Rosales. Thank you so much. And now let's move on to our next presenter. We have our next presenter is from Aklan State University, and she is an instructor with a research paper entitled Local Government Unit Health Services as Viewed by the Citizens of Banga Aklan. So, ladies and gentlemen, let us witness the video presentation of Gianni Loy de Yekla.
Yekla of Aklan State University, and I am to present our research study entitled Local Government Units Health Services as Viewed by the Citizens of Banga Aklan. The research team is composed of the following. This study was conducted by Aklan State University and was funded by the ALG. The study location was in the municipality of Banga and it started last April 2019 until September 2019. The performance of the LGU of Bangaklan in the delivery of health services was measured adopting the Citizen Satisfaction Index System or CSIS. CSIS was designed as a system of mechanisms aimed to generate citizens' feedback on the LGU's performance on service delivery and citizens' general satisfaction. Moreover, it is a source of information that identifies the strengths, gaps, difficulties, constraints, and possible improvements on the delivery of quality health services. As a feedback mechanism, the citizens, being the intended recipients and end users of public services, are in the best position to determine whether or not the services are delivered according to their needs and to the extent that they fulfill their day to day and long term human development requirements. Specifically, this study aimed to answer the following questions. First, what is the health profile of the respondents as to whether or not they got sick in the past 12 months, their most serious sickness in the past 12 months, whether or not they have consulted a medical health service provider, whether or not they have consulted a public service provider, the place of medical consultation, the primary reason for consultation, and follow up consultation after the first consultation. Second, what is the respondent's rating in the delivery of the following health services? First is the vaccination for infants or children, the prenatal, postnatal, childbirth services, the free general consultations or access to secondary and or tertiary health care, the free basic medicine or low cost program, the prevention and management of communicable and non communicable diseases, basic dental or oral hygiene, and family planning and reproductive health. And the last one, what are the recommendations from citizens on health programs and services? In the conceptual framework, there are four core concepts: awareness, availment, satisfaction, and need for action, where the attitudes towards LGU were drawn. For the methodology, there were 150 respondents from the LGU. There were males and females, and they are at least 18 years old during the time of interview. And they must be a resident of the target LGU for at least 6 months during the time of interview. The table represents how spot numbers in each barangay were derived. The study utilized the multi-stage probability sampling. The Kish grid represents how probability respondent from each household was identified. The respondents will be asked of their awareness of the service. If they are not aware, then proceed to the next service. If they are aware, they will be asked if they did avail. If they did not avail, they will be asked of the reason why, then proceed to the next service. If they did avail, they will be asked of their satisfaction. Whether they are satisfied or not, they will be asked of the reason why, and they will be asked also if the service still needs action, then proceed to the next service. Data processing involved coding and processing of quantitative and qualitative data. For data analysis, percentage scores and adjectival equivalents were used. The figure shows how percentage scores were derived, and another figure shows how adjectival ratings were interpreted. For the survey results, the respondents were asked if they got sick in the past 12 months, and most of them have not experienced any sickness during the period. Out of 150 respondents, 43 of them got sick in the past 12 months, and the highest number reported influenza as their most serious sickness. The 43 respondents who got sick were asked if they consulted a medical health service provider, and most of them indicated that they have sought medical consultation. Out of those who had medical consultation, majority of them have consulted public service provider. Out of those who consulted a public service provider, most of them had their consultation in the provincially owned or operated hospital within the province. Two primary reasons of consultation were cheaper medical checkup and cough and fever. The respondents were asked if they still consulted other public health facilities after the first consultation. Most of them did not consult any other public health facilities after the first consultation. As to the extent of awareness, availment, satisfaction, and need for action, regarding the vaccination for infants or children, awareness is high, availment is low, but satisfaction is high and need for action is low. For the prenatal, postnatal, and childbirth services, there is high awareness, low availment, still high satisfaction, and low need for action. For the free general consultations or access to secondary and or tertiary health care, there is high awareness, low availment, high satisfaction, and low need for action. For the free basic medicine or low cost program, awareness is high, availment is low, satisfaction is high, and need for action is low. For the prevention and management of communicable and non-communicable diseases, both the awareness and availment is low, there is high satisfaction and low need for action. For basic dental or oral hygiene, the awareness and availment is low, the satisfaction is high, and the need for action is low. For the family planning or reproductive health, there is low awareness and availment, there is high satisfaction and low need for action. From the study, the top recommendation from citizen was to enhance free medicine program. For conclusions, out of the 7 health services and programs, 4 obtained high adjectival ratings and 3 have low adjectival ratings on awareness. Regarding availment of the health services, all the 7 indicators have low adjectival rating. On the other hand, the 7 indicators attained high satisfaction adjectival ratings. All the indicators for need for action get low adjectival ratings. There is high awareness on vaccination for infants and children, prenatal, postnatal, childbirth services, free general consultations or access to secondary and or tertiary health care, and free basic medicine or low-cost medicine program. However, there is low adjectival rating on prevention and management of communicable and non-communicable diseases, basic dental or oral hygiene, and family planning. The overall satisfaction rating of all the 7 health programs and services is high. For recommendations to provide better health services to the people, provision of free medicines in public health facilities, accessibility of the health amenities, and regular visitation of medical doctor in the barangay to provide free checkup is recommended. Enhanced services and vaccination for infants and children, prenatal, postnatal, childbirth services, prevention and management of communicable and non-communicable diseases, basic dental or oral hygiene, and family planning. That's all. Thank you very much.
Okay, thank you so much, Ma'am Yekla. So I guess our evaluators are now ready to ask questions. So let me call in Dr. Silava.
Good morning, ma'am.
Good morning,
Good
ma'am.
morning, Ma'am Yekla. Am I right? Okay.
Yes, ma'am.
Good morning, Ma'am Yekla. So, generally speaking, there was high awareness but low availment in most of the services offered by the LGU. So,
Yes, po.
considering your findings, how do you think will this affect COVID-19 vaccination once the vaccine is there? How do you think your study will guide the LGU when it comes to the service delivery of a COVID-19 vaccine once it's available?
Based on the results of the study, since other services got high awareness but low availment, if it is applied to when COVID-19 vaccine will be available, um, what's your question, ma'am? Awareness, high availment and low awareness, right, ma'am?
No, I think majority of your results show that many of the people are aware but they do not avail of the services, right?
Yes po.
Majority naman, hindi naman lahat. So majority has high awareness but low availment. So knowing the findings of your study, how do you think will this impact COVID-19 vaccination once it's there?
On the results of the study kasi ma'am, even they get low availment and how awareness, they provided the reasons. For example, for family planning. So for family planning, it has high awareness but low availment because of the reasons that they are already senior citizens and all. So as of now, I cannot directly, based on the study conducted, I cannot directly correlate it when the vaccine for COVID is available, because the low availment got factors why the situation came like there is high awareness and low availment. They provided specific reasons for that, ma'am, because some services are not applicable to them.
Yes, I think you should include that in your discussion so that the readers will be aware of the limitations. Kasi
Okay po.
if you don't include it, it seems na ayaw lang talaga nila. But there can actually be reasons like they just don't qualify.
Yes po. Actually, we got the reasons, but since we are only provided 10 minutes, it will be a lengthy presentation, ma'am. I think so I decided to just defend it once it was questioned.
Okay, thank you for the information.
But the reasons are available here, ma'am.
Okay, thank you.
Thank you po.
Thank you so much, Dr. Silava. And now may I call in Dr. Dico.
Yeah. Good morning to our presenter, Ms. Yekla. Good morning to all of you also. I just have one question for our presenter, if she has a recall. I would just like to know about two differing results, because the awareness on the communicable and non-communicable disease program is low, but the awareness on vaccination is high. But then again, vaccination program is under communicable disease program management. So I would just like to know, how did you formulate your questionnaire so that the people will say hindi nila gaanong aware ang communicable and non-communicable diseases?
Okay po. During the formulation of the questionnaire, we went to the MLGOO, then we proceeded to the specific concerned offices. So we consulted the municipal health officers of the services they are offering, and they approved, or they have given us the specific questions, ma'am. But I think your idea is really applicable, since I already heard it yesterday during the presentation of one faculty from the Summer State University, ma'am. And yes, it's a relevant thing, the vaccination and prevention of communicable diseases. And that suggestion, ma'am, could be taken in the next studies to be conducted. Thank you, ma'am.
Okay, thank you.
Thank you so much, Dr. Dico. And now may I call in Mr. Olovia.
Hi, good morning.
Good morning po.
In the paper that I was reading regarding your research, I found out that you were describing table like table 3, percentage score for vaccination for infants and children. And then after you described the results, you were referring to table 18 again. And this happened in the several discussions. You were describing the table below, but you were referring another table, like another table, table 19 for vaccination again. So you were describing the table that follows, but you were not referring that same table. You were referring
Ah, okay.
another table.
Sorry po,
For
maybe it's
example,
a
in,
typological
in
error.
vaccination, when you refer to another table, it's no longer vaccination data. It's data
Ah,
on
okay.
in the in the communicable and non-communicable
Ah,
diseases.
okay po. Sorry for the
I
error,
noticed
sir.
a lot of yeah. How did this happen?
Maybe, sir, since it's a sub study, it's a sub study of a lengthy study, sir. Maybe I had copy pasted the wrong way, maybe, sir, or I have not proofread it yet, it's sir, kasi uh maybe a
Yeah,
scarcity of
actually, this
sorry,
is not
sir.
the only mistake
Okay po,
that
sir.
I noticed. So
Opo, opo.
just one
Kasi
more.
sir, na copy paste lang. Okay po. Thank
Yeah,
you, sir. I will proofread
just
it again.
yeah, just one more, ma'am.
Yes po.
In the table on the health profile of the respondent,
Health
you
profile.
said that 65 got sick, and then supposedly the types of diseases, the number of people who got sick, and the diseases described should equal to 65 as well. But your number is only 59. So you were lacking six responses. How did this happen again?
Again, sir. Your question was regarding on the table sickness experienced or got sick.
On,
Got,
on the table two, you mentioned that there were 65 who got sick. So the next question was, what were the types of diseases experienced? None. When you total this response, it is only equivalent to 59, not 65. So you were missing six responses here. How did this happen in your analysis?
okay po. Sir, may I ask first,
Yeah,
sir, if you are holding the full paper, or if you are
yeah.
referring to the yes po.
I'm holding it.
Sorry, sir,
Okay.
maybe it's just another error because on my presentation, 43 of them got sick in the past 12 months.
Yeah, you need to revisit your
Okay
paper
po.
because even
Thank
your
you po,
specific
sir.
objective number two, you were referring awareness, availment, satisfaction, and need for along various areas of local governance
Yes po.
in your
Thank you,
specific
sir.
objective number two. But
Opo.
your results were describing results along delivery of health services,
Yes po.
not local governance. So that's my comment about your study. Thank you.
Okay. Thank you, sir, for your suggestions.
All right, thank you so much, Mr. Olobia, and to our presenter, Ms. Jenny Lloyd de Yekla. And now we are ready to proceed to our next presenter. Our next presenter is an assistant professor from Visayas State University with research paper entitled this cares, investing, institutionalizing, strategizing community-based activities for responsive and co-equal services. So let us witness the video presentation of Mr. Joel Ray Yu Ako.
Good day to everyone. This is Joel Ray Acob of Visayas State University, and allow me to walk you through this 5-year project entitled This Cares, or Investing, Institutionalizing, Strategizing Community-Based Activities for Responsive and Co-Equal Services. With the ambition to attain Sustainable Development Goal 3, good health and well-being through upholding the primary levels of health care in the countryside, the logic suggests to equip community health workers, CHW, as prime implementers of care system. Community health workers are considered to be the frontliners of primary health in the Philippines who are expected to contribute to the improvement of health of the people for more services to their respective communities. They are amongst the first level of health workers to be acknowledged as knowledgeable about public health, technology application in health, and methodologies for health improvement. In light of the local and national dynamics for health situation and the acknowledgement that nursing is a significant contributor to health, community health workers is also strategically positioned to make a difference in the health outcomes of individuals, families, and communities they're caring for. In order for this to materialize, CHW need further formal and proper trainings for knowledge and skills in promotive and preventive health aspects for an enhanced and better service rendition. It is important for them to appreciate how primary health came about, so much so to value the current health imperatives that affect health among population, thus the priorities and actions to be made. The aim of the project is to capacitate community health workers on the promotive and preventive health approaches as major roles in the care of individuals, families, and communities as a whole. The project commenced with the different stages. Investing stage, which is to acknowledge the locally available resources to address the promotive and preventive management. These resources, may it be in the form of products and goods, human resources, and existence of organizations with similar aims of these cares. Stakeholders' trust are also recognized as a community project counterpart. This is to ensure to institutionalize and strategize responses to emerging community health issues. The goal of health in the hands of the people. Through conduct of training needs assessment, or TNA, and community organizing participatory action research, or COPAR, as tools, potentials and strengths were identified. Site visits was executed to validate the results of the TNA. MOA and development of training modules and design for CHW are also in place hand in hand. Ongoing project will last for 2024. Based from the findings of the TNA, CHW needs formal and updated training for knowledge 10 to 15 years then, their experiences through the years can be even better with training reinforcements. TNA also revealed that the lack of knowledge in the proper utilization of locally available resources prohibits them to aid the general population in health. The application of technology on one hand for public health management, especially on the non-communicable diseases, are deemed essential. Finally, the program recommends on measures on sustainability through project expansion to other neighboring institutions through linkages and adoption. At VSU, where excellence is part of one's lifestyle, community works are manifested too as expressions of our unending care. VISCA cares. Vis cares.
Thank you so much, Mr. Joel Ray. And now let's proceed to our question and answer portion. So may I call in our first evaluator to ask, Dr. Silava.
I'm sorry, I think I got lost. Is this the study on the gender differences? Hello? Hello?
Hello.
Is this the study on the gender differences in the coping mechanism? I don't think I have a paper on vis cares.
ating presenter yan, napaka-ano naman ko niya paper. Hello, yes, Dr. Silava, we will check our team regarding the paper because it has not been sent to you.
Yes, I don't think so.
All right, yes po, opo. We will go back. We will confirm first this one po. Thank you.
Thank you.
So while waiting for the paper, Dr. Silava, to be sent to you, I think we can proceed to our next evaluator to ask question. Let's have first Dr. Dico.
Hi, ma'am. Hi. Hello. Hello.
Hello, ma'am.
Yeah, okay. Same with me. I have not received the paper. Which is entitled Viscare. I think it was not sent to the three of us.
All right, ma'am. Okay, because we will still confirm this one, and we would like also to ask apology for this. So we will go back later on for the question and answer portion for Mr. Akob later on.
Yeah.
Once the papers will be sent to our evaluators.
Yeah. And so with the audio, it wasn't clear to us. The presentation was not clear to us. Mahina ang volume.
Okay po, okay po. Noted po.
Thank you.
Okay, so for the paper of Mr. Akob, we will go to our next presenter. So our next presenter is from Somers State University. She is the Director for Student Welfare and Development Services with a paper entitled Enhancing Psychosocial Well-Being of Children and Adolescents in Street Situations. So, ladies and gentlemen, let us all witness the video presentation of Dr. May B. Kanyay.
Good morning. Mine is to present a study on enhancing psychosocial well-being of street children and adolescents in street situations. Based on the 2011 data from United Nations, they have reported that there are approximately 150 street children worldwide, and they are actually expecting to increase daily. The scenario could mean that 1 out of every 60 children actually lives on the street. Though it is an international concern, but the number of increasing street children is relevant among developing countries. Based on different studies and literatures, factors associated with the phenomena has something to do with home violence, drug and alcohol abuse, death of parents, separation of parents, war, natural disasters, and socioeconomic problems. Street children becomes also vulnerable to illnesses, become victim of different abuses and violence and exploitations. It has also a developmental consequences. So based on the study, children, street children has high incidence of psychopathology, though it is more associated on dysfunctional and home environment, but the situation may actually worsen once the child begins to live on the street. Street children may also suffer behavioral disorders, may suffer from low academic performance, they may encounter problems with social relationships, and for some of them may develop impairments. The phenomenon is also the social issue is also true in the Philippines. In fact, estimated that there are actually 250 children who actually lived on the street, but it is difficult to ascertain in terms of number because of unreported cases. And through also inconsistent with other with worldwide predictors and correlates, the problem of the increasing number of street children are actually because also of poverty, belonging to low families, unemployment or underemployment of parents, limited access to essential social services, family dysfunctions, and the shift to consumerism and materialism. So through also that for some of our street children, they also suffer from high risk behaviors, from substance abuse into having an antisocial activities. The government, on the other hand, responds with this social issue by providing services through the agency of the SWD. So they have active campaign and partnership with public, uh, and they also coordinated with DILG and other private and other agencies to actually help them with their programs on street children. For LGU, for local LGU, they give financial and educational assistance. They give counseling to children and their parents. They offer livelihood to parents, and for some, they are actually being referred for rehabilitations. The problem is that for those identified individuals, especially for those who have been rehabilitated in the centers, after they go out on the centers, they still went back to the street. And for some who are under the monitoring of the CSWDO are still visible on the street. And others who have been given financial assistance on their education has been dropping out of school. So if cases such as this continue, the purpose of community-based programs, which is actually to help them to have a better life, will be defeated. Second is that we expose these children into developmental risk. We allow them to be exploited and 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 become victim of social violence, and their psychosocial aspect will actually worsen. And the more that they will encounter problem in terms of relationship with parents and other people in the community. And others, their health condition may worsen, and we might have difficulty in addressing behavioral problems and solving family relationships and the relationship in the community. So basically, the situation calls for what type of strategies and case approaches is necessary to conduct to at least reduce the number of street children, develop an assessment of needs that will become the basis for the intervention, that the intervention that will be created is actually based on the needs of these children, and develop program that would address or help them to become socially functioning, that improve their mental health and address behavioral problems and help them improve their relationship. So the studies actually under the lens of bioecological system theory of Bonfenbrenner and Vygotsky's sociocultural theory, specifically on the concept of scaffolding. Okay, so the study intended to measure the psychosocial functioning of children and adolescents in street situation in the locality and actually geared towards creating a program that actually suited to the psychosocial needs. So first questions address on what is the psychological profile of the participants. Second is identify the social workers and parent support given to the street children. And number three, develop a model program intervention program. So for our methods, it employed a concurrent triangulation mixed methods design, and the study was conducted in the locality with the street children handled by the city social welfare development as the respondents, and there are also other two institutions which serve as the secondary locale from the Visayas who have been included in the study. So based on the results of the study, participants' intellectual functioning was within the average and below average. So majority of them fell below the average range, which means that participants were experiencing difficulty dealing with non-verbal information. But on the other hand, in their interest inventory, revealed that most respondents wanted to finish college scores. So in terms of personality dynamics, there are two scales that with scores with moderately and highly noticeable. The scale on delinquency and family dysfunctions. And cognitive scales result is also consonant with the results in the measures of cognitive ability. Okay, so there are factors that we need to factors that we need to parang put emphasis on these results. Number one, being in school does not actually suffice reducing difficulties in learning. So environmental factors such as remaining visible on the street can actually contribute to their current intellectual functioning. Number two, in terms of based on the result in interest inventory, we can use that as a motivating factor so that the student finish their schooling. And number three, uh, studies pointed out that the prevalence number of street children is actually due to parents' family dysfunction. So parent separations and family dysfunctions and delinquent behaviors are actually being reinforced once the child started to be on the street. And the other factors that we need also to consider is if these children will continue to stay on the street, there is a high probability that they will copy the observed behavior from other children and thus affect their belief systems and behavior. Okay, so in terms of parent support to street children, so children are actually supported in their basic needs, health needs are addressed, educational needs, and social and emotional needs are also supported. And for child rearing practices, they are actually being taught values, discipline, and their parents are actually more concerned about their safety needs, concern needs, and the well-being of their street children. Okay, so for results and discussions for program followed by two centers, basically the centers follow the holistic development. So they have programs on psychological, mental, social, emotional, and spiritual. They consider monitoring and evaluations as important, especially in measuring behaviors of the clientele. So this becomes their basis if the client is needed to be discharged and their integration to the family. So based on the study from the psychological test of the participants and from the FGD from the parents and from the two other centers. So intervention programs should focus on health and wellness. So allowing them to have access to health centers and come up with health education program. Focus on literacy and interest enhancement since uh, uh, enhancement cognitive ability, either formal or non-formal education, at the same time to come up with programs that focus on sports skills and talent. On the aspect of mental health and psychosocial support, focus should be on delinquency and family dysfunction. So this is actually to address behavioral problems and to improve the relationship within the family members. So some studies suggested counseling of parents and children and the offering also of life skills. So in conclusion, street children's cognitive functioning is below far from the standard. So further, street children manifested delinquent behaviors and perceive their family as dysfunctional. So social workers support the areas where parents can hardly provide. And number three, the two centers actually acknowledge the holistic approach as the most effective intervention in addressing the needs of the children. And number four, the psychosocial needs of children and adolescents varied in many ways. Thus, the assessment tool played a significant role in reflecting reliable research to determine what needs to address and later develop a psychoeducation intervention program. So for recommendation, to address learning difficulty and motivate children's interest in school, structured activities and programs to enhance academic subject skills and talents can be implemented. Thank you.
Thank you so much, Dr. Maybe Kanyel, for your presentation. And now, may I call in our evaluator to ask question for Dr. Silava. If you have a question based on the presentation that have been presented, you can also ask question po.
Hi, ma'am. Good morning. I was wondering how your results. Am I right that you did your study in a rural setting?
Yes.
Yes. How do you think could that differ? For example, in the metro, like in Metro Manila, do you think you can expect the same findings? Especially now, after the pandemic, there's more of them actually. So I just want to ask for your opinion on that.
I think if we will consider the dynamics of children and adolescents and the dynamics of street children, they may have the same characteristics and manners of behavior, and the manners of behavior that they have already taken in within themselves. So I think there might be similarity also because in fact in our case in the city, our street children also is trying to adapt, like they are also into technology.
Thank you, ma'am.
All right. So I think Mamay has already answered the question. Okay, so we can go to the next evaluator to ask questions. So let's go to Dr. Dico.
Yeah. Good morning, ma'am. Good morning to our
Morning.
present. Good morning. Um, Thank you for that good presentation, an interesting topic to do. Um,
Thank you.
my question is just about applicability of the results. Ma'am, when was the study conducted? Is it recent or was it in the past?
It is,
And if it
it
is
is recent po.
it is recent, so
Yes po,
how
2019.
far have we gone as far as dissemination of the result to concerned stakeholder is concerned? If this had been absorbed by an interested party and has been taken well taken.
Yes po. The result of the study has been discussed to the parents of the street children. The same po with the city, with social workers and the head of the city, and together with the council of children and handling children and adolescents in the city. And in fact, the city is already adopting the program that I have proposed to them. And last February 2020, we have already signed a MOA between Summer State University and the LGU for the activity for street children. At the same time also carrying out the activity to our children in conflict with the law, because based from my discussions they have found out that the street children result in terms of psychological report and observation is almost the same with their observation with children in conflict with the law.
Thank you. Congratulations.
Thank you po, ma'am.
Thank you so much, Dr. Dico. And now may I call in Mr. Alovia.
Hello, ma'am.
Yes po,
Good
sir.
morning. Thank you
Good
for your
morning.
research. I'm just curious about the data collection process that you undertake in this particular study. What were the challenges that you encountered while you were collecting the data for your research?
The challenges that I have encountered while collecting the data is actually it was very difficult to gather children. So I need to take time, especially in the conduct of the psychological test, wherein children are actually given 2 days, and I do the psychological test individually with these children. So I have arranged that the test should be done in 2 days, so one in the morning, one in the afternoon, and one on the another day. So prior to the conduct of the psychological testing, I tried to conduct that. I dry run the test first to some children with the same characteristics with our three children, so that I can see and observe in terms of parang yung in terms of attention span, to make sure that the children can actually have a certain type of attention in while I am conducting the exam. But
Whether
I don't have a much problem with that because while I am conducting the activity, it is actually coordinated with the city. So they help me actually in gathering of the participants.
well, congratulations for successfully conducting the research because it's really quite a challenge to gather data from special groups like children in conflict with the law. Thank you very much for your
Thank you
presentation.
po, sir. Thank you.
Thank you so much, Mr. Olivia, and also to our presenter, Dr. Maybe Kanya. And now we are ready to move to our next presenter. Our next presenter is a faculty researcher from Somers State University with a paper entitled Diseases and Disorders Among Fisher Folks Households. So, ladies and gentlemen, let us all witness the video presentation of Miss Julienne May D. Zartiga.
Good day to the panel of evaluators and viewers of this breakout session. I am Miss Julian May Ortiga and I will be presenting the diseases and disorders among fisher folks households. Of course, the contents of this presentation will be started off by an introduction with the specific objectives of the study, methodology, results, and discussion with the conclusion and recommendation of the study. Philippines is a major fishing nation with a territorial water of approximately 2,200,000 square kilometers. And as you may already know, the fishery industry is one of the main sources of income in the country, in which, according to FAO, employed more than 1 million Filipinos. Here in the province of Samar, fishing is considered as the main livelihood of nearly 77% of people residing along coastal areas. This is because our province is covered with coastal waters. However, even with this fact, according to the Philippine Statistics Authority, fisher folks still consistently top as one of the poorest sectors in the Philippines. In a study of Israel, he stated that households whose heads are fishers had significantly higher poverty incidence than households in general. Poverty, which is a common problem in our country, thrives in fisheries sector not just because of the uncertainty of income among fishing communities, but also because of some factors like debt, access to health, education, and financial capital. Israel also added that those in the fishing industry have heads with relatively lower education levels, and their inability to access education implies that their access rates to basic necessities like safe water, sanitary toilets, and electricity proportionally lowers. These led them to have various diseases and disorders. Like other industries, in the study of Maruia, she stated that various diseases and disorders are experienced in the fishing sector because of different hazards and risks offered by their occupation. It is also worth noting that the diseases and disorders met by fishers in this sector have the potential of affecting human activities. In a study of Olaoli, he pointed out that the developing countries, like the Philippines, has several stakeholders that tend to ignore the policies that could ensure safe fish processing practice. This is why this study is made to provide demographic information about the members of the households headed by fishers, and more importantly, the prevalence and distribution of disorders among diseases among them. This will be a good basis for the fishery management and policymakers to create immediate health intervention strategies and programs that will promote a sustainable fishery industry. The main objective of this study is to determine the prevalence and distribution of disorders and diseases among fisherfolk's households in summer Philippines. Specifically, it aimed to determine the demographic profile of the members of fisherfolk's households and determine the prevalence and distribution of diseases and disorders among the members of fisherfolk's households. This study was conducted in the province of Samar, covering 12 barangays. This is limited to households headed by fisher folks and depend on fishing as their main livelihood or source of income. The research design adopted was descriptive quantitative design. A total of 150 fisher folks households and 526 members that were interviewed with questionnaires that were pre-tested and validated by some respondents to guarantee relevant data gathering process. The data gathered from the questionnaires were analyzed using descriptive statistics, specifically frequency count and percentage. To start with the demographic profile of the members of fisher folks households, let us look at this figure. This figure shows that most of the members of fisher folks households are dominated by the age bracket 25 to 59 years old. It is followed with the age bracket 10 to 19 and the age bracket 0 to 9 being the lowest. This result shows that 57.79% of the population of fisher folks households are adults. This matches to the result of the study of adulthood with the implication that most of the fisher folks are within the active and productive age group. This group is efficient for fish production. Jupton also indicated that fisher folks are dominated by males. On the estimated monthly income of the fisher folks households, the highest income ranges from 3,000 to 4,000 for 26% out of 150 households. This monthly income is determined to be part of poor income classification as indicated in the Philippine Institute for Development Studies. This is followed by 1,000 to 2,000 or 21% and 11,000 being the least possible income of the fisher folks households. However, a noticeable 5% of households earn more than 12,000 per month. The mean average of the estimated income of fisher folks households is about 4,295 pesos. This figure shows that out of 478 individuals who experienced diseases or disorders related to musculoskeletal system, 44.56% experienced back trouble. This means that for every 20 individuals, 9 of them have back trouble. In the study of Balachi, it was stated that prolonged awkward postures like rotation, bending from one side to the other are common causes of weakening and elongation of the muscles. On the diseases and disorders related to the nervous system, 143 or 46.43% of the members of fisher folks households said that they have experienced nervousness out of 308 individuals, meaning that for every 15 individuals, about 7 of them are likely to have nervousness. This is followed by the pinched nerves that is 39.28%, neuritis and seizures with both 7% and epilepsy being the least possible disease that an individual could have. Among the respondents who experienced diseases and disorders related to the respiratory system, about 46.83% of the individuals have asthma hay fever, which conveys that for every 15 individuals, about 7 of them are likely to have an asthma hay fever. On the diseases and disorders related to the cardiovascular system, 79 or 53.74% out of 147 respondents have high blood, and this means that for every 15 individuals, 8 of them are likely to have high blood. On the diseases and disorders related to the urinary system, 39.71% of the individuals have a bladder infection, meaning for every 10 individuals, about 4 of them are likely to have a bladder infection, while fewer patients with kidney diseases, approximately 27.94%, implies that for every 15 patients, about 4 patients are likely to have kidney disease. It is therefore shown that the most frequent disease experienced by the members of the fisher folks households is back trouble, which is 40.49% of the total respondents. This is followed by the 27.18% of the nervousness, 23% of the pinched nerves, 18.06% of arthritis, and 15.97% of joint injuries. This implies that most of the members of fisher folks households met diseases and disorders related to the nervous and musculoskeletal systems. Results also illustrate that these common disorders and diseases are prevalent among the age bracket 25 to 59 years old. On the age bracket 0 to 9 years old, the prevalent disease is asthma hay fever, which is 7% out of 35 individuals. The same with the age bracket 10 to 19 years old with 14.81%. This may be caused by the personal habits and exposures of individuals to dirt and smoke. Results also illustrates that 20% of the 50 young adults experienced joint injuries. Back trouble and other musculoskeletal is prevalent among the members of fisher folks households, especially those in the adults and senior age bracket because of the nature of their work. There are relatively 165 individuals, or 53.785% out of 307 respondents within this age bracket have experienced back trouble. This suggests that healthcare interventions, programs, and activities must be conducted within the age bracket 25 to 59 years of ages. Programs related to food security, nutrition, and health of adults and senior adults are recommended, and medical programs and treatments may also be helpful to lessen the number of individuals experiencing back pain or trouble, arthritis, pinched nerves, and nervousness. Fisher folks play a big role in our community, and all of us know that. In creating health intervention strategies and programs, guidelines, and policies are needed for their health to promote a sustainable fishery industry. That's all. Thank
Thank you so much, Ms. Zortiga. And now our evaluators are ready to ask questions about your paper. So let's have first Dr. Silava.
Hi, Miss Julian. Good morning. I just wish to
Morning,
know
ma'am.
how you chose the diseases to check. Like, how did you come up with your list of diseases to evaluate? How did you diagnose or ask? Did you look at medical records or did you just interview the patients? I'm asking because I don't necessarily understand what you mean by nervousness. Um, what's the difference between kidney trouble and kidney disease? What do you mean by pinched nerves? There are a number of disease entities that I'm not quite sure what you mean. So how did you? What was your case definition? How did you ask?
Okay,
That's
ma'am.
all.
So actually, ma'am, the diseases and disorders that we used are the common disorders that we have researched. But then, to guarantee data gathering process, we also asked the researchers also asked some of the respondents for the diseases and disorders they have experienced. So we add this to the common disorders and diseases that we have researched.
Okay, so I just think you need to double check so that when you make your paper, you make it more medically sound. You can use medical terms that are more appropriate or more specific, so that when medical doctors look at your study, they would understand what you mean exactly. That's
Okay, ma'am.
all.
Thank you so much, ma'am.
Thank you so much, Dr. Silava. And now let's have Dr. Dico.
Yeah. Thank you so much, Miss Julian May, for your presentation.
Yes, ma'am. Thank you, ma'am.
This is a good study that will help our fisher folks, especially that your area of study is a fisherman's village, so
Yes,
to
ma'am.
say. Okay. This is also in relation to Dr. Silava's comment on how you extracted or gathered this kind of diseases or this nomenclature, this list of diseases. Did you take it from a review of literature?
Yes, ma'am. Actually, ma'am, as what I have said a while ago, some of the common diseases and disorders were from other researches, but then we also asked the respondents of the diseases and disorders that they have experienced.
Yes, because asthma and hay fever is added here. And is this a local research you got your review of literature from, or these are also international studies?
Local, ma'am.
Local, okay. In line with that, I would just like to know if your prevalence study is also meant to associate this list of diseases to the occupation of fishing. Is this kind of associating the list of illnesses and disorders to the kind of work that they have, like fishing, or you just run it down as this is These are the kinds of diseases our fisher folks are experiences regardless of where they got the disease.
From the
How would you make your general conclusion?
the paper focused only on the frequency count and percentage of each diseases and disorders among the members of fisher folks households. But then, as what you have said, that will be a recommendation for the addition of this study of this paper, because I haven't do that. I was not able to do that, correlating the diseases and disorders to that.
Okay. So it's just a run through of the list of diseases that they're experiencing, but not really correlating the occupation with the disease.
Yes, ma'am.
Clear. So thank you. Thank you for your answers.
Thank you, ma'am.
Thank you so much, Dr. Dico. And now let's go to Mr. Olobia.
Hello, good morning, and thank you for your presentation.
Morning,
Okay,
sir.
so what is what's curious about their studies is the research question on diseases among family members of fisher folks. In your preparation for this conduct of the study, what were your specific data that tells that this is a good research question? Do you have data to share, like some of the fisher folks family are experiencing some kind of diseases in the locality that in the study area that you where you conduct your study? Do you have specific data how many of the members are sick with particular disease? What was your basis really for formulating this research question? Is it just because they are members of the fishermen? And it really intrigues me why diseases among members of the family of fishermen was was the nature of your study. What was
Okay,
your
sir.
specific data basis for formulating this kind of research question?
Oh, yes, sir. Um, uh, This we I actually do not have, sir, the data or the particular numbers of the diseases, kung how much of this disease, how much of the fishers have this particular disease. But I have a data of the study of Ngaruiya, wherein he said that there are various diseases and disorders that are experienced by fishing sectors because of the hazards and risks offered by their occupation. That is why I am curious as to what are these diseases and disorders? What are the diseases and disorders that are prevalent to these fishers among these coastal areas?
Okay, thank you very much for that answer.
Yes po, sir. Thank you, sir.
All right, thank you so much, Miss Julian, for your presentation and to our evaluators. And now let's move on to our last presenter for this track. So our last presenter is a science research assistant from Visayas State University with paper entitled Gender Differences in the Coping Mechanism to Disruptions Brought by COVID-19 Pandemic among working adults in the Philippines. So, ladies and gentlemen, let us all witness the video presentation by Ms. Therese C. Ratilla.
Good day, everyone. Therese Retilia presented a paper entitled Gender Differences in the Coping Mechanism to Disruptions Brought by COVID-19 Pandemic Among Working Adults in the Philippines. As we all know, COVID-19 national concern in January 2020. From an outbreak, this escalated to a pandemic in March 2020. As a result, the Philippine national government declared a national emergency and imposed months of community quarantine and lockdown measures from ECQ, MECQ to GCQ to fight the spread of the virus and flatten the curve of deaths brought by COVID-19. Following the mandate of the national government, the provincial government of Leyte enforced a general community quarantine since March 18, 2020. As a result, there has been restrictions to travel, closure of establishments not providing essentials, closure of schools, adoption of work from home arrangements, and etc. As COVID-19 threatens the national security and the economy as a whole, it also poses a great threat to the people's mental health condition. This is because COVID-19 can cause stress, anxiety, extreme worry, panic, and depression, among others. This will greatly affect those that are clinically diagnosed with mental health problems such as anxiety or depression. So, COVID-19 pandemic is a rolling combination of health and economic crisis. Each individual reacts differently to the situation and is affected by several factors such as socioeconomic background, the community he or she lived in, gender, and etc. So some may have coped better and some may have coped worse. In VSU, faculty and staff have varying conditions in this time of pandemic. The general aim of this study is to assess the gender differences in the coping mechanism of VSU faculty and staff amidst the COVID-19 pandemic. Specifically, we aim to describe the socio-demographic characteristics and conditions confronting the working adults during this period of COVID-19 pandemic, identify the gender differences in their adopted coping mechanisms, and determine factors affecting the coping mechanism of VSU constituents. This study will therefore provide a general picture on how men and women handle the situation differently to stay sane amidst the stress brought by COVID-19 pandemic. Results of the study will also provide recommendations to the administrators of the university that can help faculty and staff to maintain their physical and mental well-being in this period of COVID-19 pandemic. Data was collected through an online survey from May 18 to 23, 2020. A total of 133 respondents answered the survey. Data cleaning was done and analyzed using SPSS and state. Descriptive statistics and regression analysis were also done. The econometric model of the study is as follows. Regression diagnostics were also conducted to test the validity of the results of the regression analyses. For the consistency of the graphs in showing the results, the fraction of male is denoted by brown and the fraction of female is denoted by orange. Of the 133 respondents, 67% are female, while the remaining 33% are male. Majority of the female respondents are staff, while majority of the male respondents are faculty. In terms of age, the average age of female respondents is 36 years old and the average age of male respondents is 32 years old. Most of the respondents are single, followed by those who are married. The average household size is 5. In terms of education, more than half of the respondents attained bachelor's degree. This is followed by those respondents with master's degree. Furthermore, in terms of income, most of the female respondents are gaining income in the range of 20,000 to 40,000 monthly. For males, 34.1% of male respondents are earning 20,000 to 40,000 as well as below 20,000 pesos monthly. Community quarantine, most of the respondents are staying with their family. Pets are also considered as one of the important companions during the pandemic. In terms of emotional state, most of the respondents, both male and female, are worried and hopeful. Disaggregating both sexes, women are more worried than men, while men tends to be more bored than women. In terms of assistance received in response to the COVID-19 pandemic, almost all of the respondents have not received cash assistance. This is because all of the respondents are faculty and staff of the state university. That is why they are not considered recipients of the social amelioration program. So only those who belong to the poorest or informal sector are target beneficiaries of the social amelioration program of the government. Nevertheless, more than half of the respondents have received non-cash assistance in the form of fresh vegetables, canned goods, groceries, seedlings, and etc. In terms of internet accessibility, results show that majority have access to internet, around 75.2%. When asked to rate the speed of their internet, majority of both gender indicated fair speed. Moreover, in terms of the presence of comorbidities, around 75.2% have indicated to have none. Among those 24.8% who indicated to have comorbidities, anxiety disorder ranks first, followed by diabetes, then asthma. For the coping mechanisms during the pandemic, there are several coping mechanisms identified. So, on average, there are 7 identified coping mechanisms with a maximum of 12 and a minimum of 2 coping strategies. This graph shows the identified coping mechanisms during the COVID-19 pandemic as disaggregated by gender. So, looking at the general picture, it shows that the major coping mechanism of the respondents for both men and women is doing household chores to cope up with the current situation. For women, the coping strategies that they are more inclined in doing are praying, spending time with family, and gardening. Interestingly, men are more into social media usage, surfing the internet, and educating themselves through reading and writing. This table presents the results of the multiple regression analysis showing the relationship between the number of coping mechanisms during COVID-19 and the explanatory variables. To highlight, assuming all things are constant, having an income of 40,000 to 60,000 and having an income of 60,000 to 80,000 as compared to income of below 20,000 can significantly increase the number of coping mechanism by 2. So the more income you have, so the more coping mechanism or coping strategies that you are doing. Interestingly, having an internet access also positively influences the number of coping mechanisms by 1. So this implies that the presence of internet helps respondents to cope better during the COVID-19 pandemic. So, having an internet allows an individual to do a lot of things, making him or her preoccupied. So, these activities can range from using social media, so surfing the net to gather information, read the news, learn something new like cooking, gardening, art, or you can also earn through online selling. You can, through the presence of internet, people can also connect virtually with friends, family, and relatives. So these results also support the study of the United Nations Development Program 2020. So regression diagnostics has also proven that our model has no problems in terms of heteroscedasticity, multicollinearity, normality of residuals, and omitted variables. In conclusion, to cope with the effects of COVID-19 pandemic, the study revealed that both men and women are mostly engaged in doing household chores. On one hand, women are also more inclined in praying, spending time with family, and gardening. Meanwhile, men are more into social media usage, surfing the internet, and educating themselves through reading and writing. And on average, there are 7 identified coping mechanisms during the pandemic. Um, The findings and the conclusions of the study suggest that the faculty and staff of VSU should employ multiple strategies and engage themselves more in physical activities such as doing household chores to help them cope better during this health crisis. So these coping mechanisms tends to be more effective to both men and women in staying sane since it keeps them proactive. So this can improve their mental and physical health by alleviating stress. So it is also highly recommended that the university should take part in amplifying awareness about healthy coping mechanisms. Stress debriefing or psychosocial support activities or services should also be done and be readily available, especially to those who need it the most during this time of pandemic. So these activities or services could be provided through online platforms like Google Meet or Zoom. So this will be beneficial to both men and women, faculty and staff in preventing stress-related illnesses and engagement of unhealthy and maladaptive coping mechanisms. So I guess that is all. Thank you very much for your time and keep safe. So your comments, suggestions, and your questions for the improvement of this study is also highly appreciated. Thank you very much.
Thank you so much, Ms. Therese Ratilia. So now our evaluators are ready to ask questions. So let's have first Dr. Silava.
Hi, Ms. Therese. Good morning.
Hello, good morning.
Congratulations on your research. I just wish to ask because I'm curious why you decided to use or to focus on gender differences. Like there are other variables that you can look at, like staff versus faculty or BS versus MS versus other educational attainment. I, I, I'm, I wonder why you decided to focus on the gender differences when it comes to coping, not the other variables, and why you didn't just talk about the coping mechanisms in general.
Because this research project is in partnership with the Gender Development Program of the university. That is why we decided to look on this. We limit the study on this scope only. Po.
Okay, thank you.
All right. Thank you so much. So now let's go to Dr. Dico.
Yeah. Good noon to our presenter. Congratulations for
Thank you
coming up
po.
with a GAD project. I was also a GAD focal person. So I could understand why you choose gender to be the center of your topic. Now, I would like to know from the results of your study, aside from your university's GAD program, who else would you know, or what agency would you know would be most interested in the applicability and usefulness of your study?
The institute, the ISRDS po, ma'am. Institute of Strategic Research and Development Studies. Uh, this will be applicable to their sociology studies. This study will be also important to the College of Nursing also because we are talking about mental health issues and risk and etc.
Okay. So thank you. Thank you for your answer.
Thank you din po.
Thank you so much, Dr. Dico. And now let's go to Mr. Olivia.
Hello, Mom Therese, presenter for this paper. I understand you did a very good study because the way you presented your results and your analysis. I was just curious about your data collection instrument because you used Google Sheets. Did you make
Yes po.
some pre-testing? How did you prepare your questionnaire?
We did some pre-testing po before we sent it to everyone. So
What were some modifications that you make after your pre-testing?
first is the ordering of the questions. And then second is we added some questions that were not included, such as the emotional state. they wanted to identify all the emotional states. And then for the gender, we included every social construct like male, female, LGBTQ, and we also provided uh, others wherein they can specify their gender uh, based on their gender. So yeah, and then we also added some data, a question for the data on stress levels, although I did not include it here on the presentation. And then and also some of the recommendations or the problems that the faculty and staff are facing. We also included it in our study. That's all.
Okay, thank you. Congratulations for your paper.
Thank you.
Thank you so much to our evaluators and to Ms. Therese. Actually, in our chat box, there is a question for Ms. Therese, but we will just let Ms. Therese to answer the question using our chat box, okay? All right, so all our presenters were able to present and showcase their researches for our track one. So at this juncture, we will be awarding our certificate of recognition to our panel of evaluators. Okay, so we would like to award virtually our certificate of recognition to our panel of evaluators. First, we have Dr. Shiraya Lane, MD Paz Silava.
Thank you.
Thank you so much, Dr. Silava. So our certificate of recognition is signed by our university president, Dr. Marilyn D. Cardoso, and also Dr. Benjamin L. Picayo, University President of Northwest Commerce State University, the co-host for iPOVCON 2020. Thank you so much. Another certificate of recognition is awarded to Dr. Fidelita D. Dico.
Thank you,
Our
ma'am.
certificate of recognition is signed by our university president, Dr. Marilyn D. Cardoso and Dr. Benjamin L. Picayo. Thank you so much. And lastly, certificate of recognition is also awarded to Mr. Leonido Olobia. Our certificate of recognition is signed by our university president, Dr. Marilyn D. Cardoso and Dr. Benjamin L. Picayo. Once again, our heartfelt gratitude to our experts, our panel of evaluators for our track one. And also, we would like to extend our appreciation and congratulations as well to our presenters, our 8 presenters for track one. And we would like also to acknowledge the presence of our LGUs who are on board this morning. So we have from TESDA, Nueva Vizcaya Provincial Office. We have also the Provincial Social Welfare and Development Office, Pangasinan. We also have Office of the Civil Defense. Also on board is from National Commission on Indigenous People, Region 1. And also we have the Department of Tourism, Region 8. We have also the Planning Officer, EMB, DNR Region 2, DOST Provincial Science, and also from Occidental Mindoro. And we have also with us this morning, the City Planning and Development Office, LGU Taguig, and CHED Region 8. Thank you so much, everyone, for witnessing the presentations for track one. But before we proceed further, I am back. So once again, I am requesting everyone to please be on board this afternoon. For our keynote speaker this afternoon will be Dr. De Vera. So we will be sending the link for this afternoon session in our chat box. Okay? All right. So this concludes our morning session for our research presentation for track 1. So this has been your moderator, Natalie. Thank you so much and see you tomorrow for our third day of the second iPOVCON. Thank you so much, everyone, and keep safe.
Thank you.